Good morning, everyone. Bonjour à tous. Before I get started, I want to take a moment to recognize that this will be an incredibly difficult weekend for many people across Nova Scotia. To everyone who lost someone and to the entire community, know that Canadians are holding you in our hearts. Aujourd'hui,
Today, I'm going to talk about public health measures, vaccines, and support for Canadians. Let's start with public health.
Canada continues to face an incredibly serious situation with this third wave. Cases are rising rapidly. In many places, numbers are higher than they've ever been before, and far too many hospitals are stretched way too thin. In Toronto in particular, numbers are breaking record after record, and ICU hospital beds are filling up. There's no doubt that Canada's largest city is struggling under the weight of this third wave, so we're going to do whatever it takes to help. On vaccination in particular, Ontario has reached out for more support. I can tell you today that we are standing by to deploy the Canadian Red Cross to help with their mobile vaccination teams. This is about getting doses to people where the situation is most serious. And we'll also continue to help on a whole range of other fronts, too. Discussions are ongoing about extra healthcare providers, and we are ready to step up. We've also already deployed mobile health units that set up more hospital beds in Toronto and Hamilton. For Ontario, we've shipped out more healthcare equipment, like oxygen units and drugs to treat COVID-19. We have approved a request to have the Canadian Red Cross deployed in up to 27 long-term care homes as needed. We're supporting safe isolation sites everywhere from Toronto to Peel to Thunder Bay. And we have deployed 300 contact tracers doing thousands of calls a day for Ontario, and lab support, which has already processed over 15,000 samples so far. Yesterday, I spoke with Mayor Crombie of Mississauga, Mayor Tory of Toronto, and Mayor Brown of Brampton. We talked about what's going on in the GTA and what that means for hospitals, schools, and small businesses. We also talked about the fact that this is a moment when we all have to work together to flatten the curve while getting vaccines into arms as quickly as possible. Earlier this morning, I also spoke with Mayor Scarpitti of Markham. I told him what I told the other mayors last night, that our government is here to help. And that's true for every community in Canada. No matter where you live, know that we have your back. We're supporting COVID-19 testing for people in BC, Alberta, and Manitoba through mobile labs that can reach more patients. We're providing help on isolation sites in places like Nova Scotia and Saskatchewan to stop cases spreading. And across the country, we've stepped up with money for school safety, shipped out PPE, and of course, delivered vaccines. The frontline workers, people working in hospitals, those they're caring for, and their families, know that we have your backs, even as you have ours. You've been heroes throughout this pandemic, stepping forward to help all Canadians. We recognize that. We continue to be there for you. You don't have to face this alone. We will support you and your families as you keep us all safe. Thank you for what you're doing. And to all Canadians, I know you're exhausted. I know you're all sick and tired of COVID-19. I know nobody wants to be in this third wave. Nobody wants to be facing further restrictions. We just want to be done with this. But we know how to do what we need to do. We need to follow the public health rules. We need to hang in there and hunker down for a number of more weeks. Nobody wants to do this. I got in an argument with my 13-year-old this morning who doesn't want to do this. Nobody wants to do this. But we know that if we hang in there, hunker down, and follow the rules for the coming weeks, as much as we're tired of them, as much as we're frustrated, we have a chance of getting to the summer in much better shape. This is a moment for us to dig deep at what is hopefully the very late stages of this pandemic for us all and make it through. It's time to show our neighbors and our loved ones what we're all made of as we keep people safe. La semaine passée,
Last week, I repeated to the premiers of provinces and territories that we are ready to offer them all the necessary support. We are currently going through a very serious period in this crisis. It is important that we all continue to work as a team. Together, we will get through this.
on vaccines, while we, like many other countries, have been impacted by manufacturing challenges at Moderna's European facility, this morning I have some very good news to share about Pfizer. Canada has now signed an agreement with Pfizer for 8 million more doses of the vaccine. This is on top of what we have already purchased. I want to thank everyone at Pfizer for their cooperation and hard work, not just to keep deliveries on schedule, but to move more doses up and reach new agreements. With the new deal, Canada will receive 4 million additional Pfizer doses in May, another 2 million in June, and 2 million more in July. For next month alone, this will come out to about double the Pfizer doses we were originally expecting. All told, we'll be receiving 8 million doses in May and almost 12 million in June from Pfizer alone. Now that's a lot of numbers, so here's the bottom line. More doses arriving sooner means more people getting their vaccines faster. And that means more people who are safer and more families that can breathe a sigh of relief.
Canada has now reached an agreement with Pfizer for an additional 8 million doses on top of what we have already purchased. As a result of this agreement, we will receive 4 million additional doses in May, 2 million additional doses in June, and 2 million additional doses in July. In short, this means that we will receive about twice as many doses of Pfizer's vaccine as planned for May, and millions more in June. We are working hard to get every Canadian vaccinated as soon as possible. I know that many people, especially young people, are waiting patiently so that their grandparents, parents, and frontline workers can get their vaccine first. Thank you, and hang in there. You will get your dose soon. We are on track to fully vaccinate everyone who wants it by the end of September. I know this spring is tough, but the summer and autumn will be better if we stick to our guns and follow public health rules.
Remember that this won't last forever. There's every reason to believe that we're now in the final, although toughest, stretch of this pandemic. This is not the moment to let up, not even for a second. So no matter where you live, keep your distance, wear a mask, stay home whenever possible, wash your hands, download and use the COVID Alert app, and be sure to follow local public health guidelines. Hang in there a little longer because we're going to get through this. C'est tout à fait normal.
It is perfectly normal to feel anxious or stressed at the moment. You are not alone. Your mental health is important, and there are people who can help you. If you are experiencing difficulties, do not hesitate to ask for help. A year ago, the online portal Wellness Space Canada was launched. This website offers free and confidential mental health and substance use support 24 hours a day, 7 days a week. In 1 year, more than 1.2 million people across the country have used this resource. There is no shame in needing to talk to someone or in asking for help. So, whether you're looking for advice, resources, reliable information, or immediate support, you can always go to the Wellness Space website for help.
Whether on vaccines, healthcare resources, or mental health support, we're focused on what you and your family need to get through this crisis. On that note, this Monday, we will be releasing our 2021 federal budget. In the last few days, I've had meetings with all of the party leaders to discuss that budget. As I said to each of them, it's vital that we work together right now. This is especially true on measures that are about helping you get through this pandemic, whether you're a parent, a student, a small business owner, or a senior. On aura plus de
We will have more to tell you next Monday about the plan we are implementing to keep Canadians safe, to create jobs for the middle class, and to rebuild a clean, resilient economy. But for now, I'll just say this. All of the measures in Budget 2021 are focused on helping you through this crisis and rebuilding a stronger Canada for everyone.
Finally, I just spoke with Her Majesty the Queen to extend my deepest condolences and the condolences of all Canadians on the passing of His Royal Highness the Duke of Edinburgh. She expressed to me how touched she was by the tributes that have been flowing in from Canada and around the world for Prince Philip. And she highlighted and remembered for me all the fond memories she holds of trips to Canada with him over the past many decades. Prince Philip's legacy of service will be long remembered here in Canada, especially in his work to empower young people. Merci tout le monde. Thank you. I'll pass it now to Minister Anand. Anita.
Thank you, Prime Minister. Good morning, and thank you all for joining us today. I will take just a few moments to expand on the additional Pfizer deliveries that are coming to Canada in May and June, as well as provide some other vaccine updates and how they fit into the overall vaccination campaign. À ce jour, plus de
So far, more than 12 million doses have been delivered to Canada, and we are working diligently with our suppliers to further accelerate and supplement our delivery schedules. And that work is paying off. For example, we were originally planned to receive 6 million doses of vaccines before the end of March. We exceeded this target by 3.5 million doses and reached 9.5 million.
As the Prime Minister has just announced as well, this week we have secured an additional 8 million Pfizer vaccine doses under our agreement. The first 4 million additional doses are scheduled to arrive in May, followed by 2 million doses in June and 2 million more doses in July. In addition to this, Pfizer is also moving another 400,000 doses from the third quarter into the month of June. Thus, the delivery schedule for both May and June will see approximately 2 million doses of Pfizer coming into the country every week, and indeed in June, that amount will be more. There will be 12 million doses spread over the 5 weeks in June. The total is going to be 24 million doses between April and June from Pfizer alone. That is excellent news. C'est une excellente nouvelle.
This is tremendous news for Canadians. It means more Pfizer vaccine doses will arrive sooner on top of the millions of other vaccines we already have coming. As I have repeated often, including with PPE and now vaccines, the global market remains highly competitive and volatile.
In this vein, as Moderna indicated this morning, it faces ongoing challenges with ramping up production to meet intense global demand due to labor shortages and other issues. As a result, our next shipment will be smaller than expected, and we may see additional delays over the coming months as Moderna's production capacity continues to increase. This news is obviously very disappointing. Our government will, however, continue to bring vaccines into the country in the face of volatile supply chains. Remember that a year ago, vaccines didn't exist for COVID-19. Supply chains and manufacturing systems did not exist either. We will continue to press Moderna and all of our other suppliers to do everything possible to respect their delivery targets and to provide more consistent delivery schedules. I can now also provide an update on anticipated deliveries of Johnson & Johnson's vaccine and Astrazeneca. Canada will receive an initial shipment of approximately 300,000 doses during the week of April 27th to be delivered to the provinces at the beginning of May, with more substantial deliveries coming in the latter part of this quarter and into the summer. For Astrazeneca, Canada is still expected to receive 4.1 million doses from all sources by the end of June, with further deliveries in the third quarter. Indeed, I spoke with AstraZeneca executives this morning and am pressing for more AstraZeneca doses to Canada in the coming weeks and months ahead. In total, Canada will receive between 48 to 50 million doses of vaccine by the end of June. Despite the temporary and short-term fluctuations in deliveries from our suppliers, Canada's vaccination campaign overall is gaining ground. We are currently ranked 4th among G20 countries for doses administered per capita, and 2nd in the G20 when it comes to the average number of doses administered daily per capita. Cela dit,
Make no mistake, however, despite this great progress, there remains much more work yet to do, and our government will continue to ensure that this work is done. These next few months are crucial. All Canadians must do their part and remain steadfast in following the guidance of our public health officials whilst inoculations roll out across the country.
our government will do its part by continuing to support Canadians in our time of need. And I can tell you that my team and I will do whatever it takes to ensure that an accelerated flow of vaccines will keep coming into this country. At the end of the day, I'm a mom with a spouse and 4 kids and 3 dogs. I feel the urgency, like everyone else, to get vaccines to Canada as soon as possible. Every day, my team and I are ensuring that our delivery of vaccines increases for the benefit of all Canadians. Merci beaucoup. Thank you. Miigwech. Dr. Tam?
Bonjour. Bonjour. Hello. Good afternoon and bonjour à toutes et à tous. So to date, over 1,096,000 cases of COVID-19, including 23,500 deaths have been reported in Canada. Over the past week, there have been an average of over 8,600 new cases reported daily. During the same time, the number of people experiencing severe and critical illness continues to rise. On average, over 3,400 people with COVID-19 were being treated in our hospitals each day, including almost 1,500 people being treated in intensive care units, representing a 34% and a 22% increase, respectively, compared to the prior week. Unfortunately, we're now beginning to see an increase in the mortality trend, with an average of 41 deaths reported daily over the past week, which is a 38% higher than the week prior. There are over 51,600 variants of concern cases reported to date across Canada, with the B117 variant accounting for almost 96% of these. On this final or last stretch through this crisis, we can also gain strength from good news and focusing on the things we're grateful for. We have been heartened by the many ways Canadians are helping to support COVID-19 vaccination efforts. Since April is the Sikh Heritage Month, we'd like to highlight an example we recently learned about from that community. Sukhmeet Sachar, a UBC, University of British Columbia, medical student, has been working together with the Sikh Health Foundation and a team of volunteers to translate and share information about COVID-19 with Punjabi-speaking seniors in the Fraser Health region. Their efforts are helping to support community members to make an informed decision on vaccination and at the same time dispelling misinformation. This week, we were also grateful to be among the over 7 million people in Canada who have received a first dose of COVID-19 vaccine to date. And the good news is that vaccines are reducing severe illness, deaths, and outbreaks in high-risk settings and populations that were targeted in our initial phase of vaccinations. Though we all need to keep following public health advice and maintaining our well-practiced precautions as vaccines roll out further, these benefits are building, and they will be the bridge that takes us all to greater safety and back to the things we have missed so much. Thank you.
Bonjour à toutes et à tous. À ce jour,
Good morning. To date, over 1,096,000 cases of COVID-19, including 23,500 deaths, have been reported in Canada. Over the past week, there have been on average over 8,600 new cases reported daily. During the same period, the number of people experiencing severe and critical illness continues to rise. On average, over 3,400 people with COVID-19 were being treated in our hospitals each day, including almost 1,050 people being treated in intensive care units. This represents a 34% and 22% increase, respectively. This compared to the prior week. Unfortunately, we are now beginning to see an increase in the mortality trend, with an average of 41 deaths reported daily over the past week, which is 38% higher than the week prior. There are over 51,600 variant of concern cases reported to date across Canada, with the B117 variant accounting for almost 96% of these. On this last stretch through this crisis, we can also gain strength from good news and focusing on the things we are grateful for. We have been heartened by the many ways Canadians are helping to support COVID-19 vaccination efforts. Since April is Sikh Heritage Month, we would like to highlight an example we recently learned about from that community. Sukhmeet Sachar, a UBC medical student, has been working together with the Sikh Health Foundation and a team of volunteers to translate and share information about COVID-19 with Punjabi-speaking seniors in the Fraser Health region. Their efforts are helping to support community members to make informed decisions on vaccination and, at the same time, dispelling misinformation. This week, we are also grateful to be amongst the over 7 million people in Canada who have received a first dose of COVID-19 vaccine to date. And the good news is that vaccines are reducing severe illness, deaths, as well as outbreaks in high-risk settings and populations that were targeted in our initial phase of vaccinations. Though we all need to keep following public health advice and maintain our well-practiced precautions as vaccines roll out further, these benefits are building, and they will be the bridge that takes us all to greater safety, as well as back to the things we have missed so much. Thank you.
Merci, Dr. Nou. On va maintenant passer
Thank you, Dr. Nu. We'll now move on to questions and answers on the phone.
to the room. Please note that Minister Anand and Dr. Tam will have to leave at 12:30. Opérateur, c'est à vous.
Thank you, merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question is from Marika Walsh of the Globe and Mail. Please go ahead. Your line is open.
Good morning. Thanks so much for taking our questions. Prime Minister, my question is for you. The Canadian Medical Association is calling on the federal government to change its vaccine allocation and to now start allocating vaccines based on needs in region and not based on per capita. Will your government do that?
Thank you, Marika. These have been conversations we've had ongoing with the provinces over the past many months. Working with the provinces, we arrived at a per capita allocation formula with a carve-out for the northern territories to make sure that they could get rapidly vaccinated because of the level of vulnerability. But of course, we're happy to continue to work with the provinces on adjustings as the provinces see necessary.
So
Depuis les débuts, nous avions
Since the very beginning, we have been working with provinces and territories to ensure that there is a fair allocation of vaccines throughout the country, with an exception made for a greater number of vaccines for the Great North, where there are particular vulnerabilities, but obviously we are always open to discuss with provinces in order to modify allocation amounts if they're interested.
Thank you. So should I take from that you do not personally support changing the current allocation method from per capita? And my next question is on the request from Ontario for 600 critical care staff. Does Canada have that slack in the system that it can send Ontario 600 critical care staff? And if not, are we talking to the U.S.?
We are extremely preoccupied with the situation right now in Ontario, and as I told mayors last night, as I've told my members of Ontario caucus, and as officials have been engaged back and forth with the Ontario government, we are there to help. We look forward to delivering any and all supports that they need. Those conversations are extremely live right now and ongoing. I know there's also been discussions about healthcare resources from other provinces turning towards Ontario. These are all the things that we're working very, very hard on right now to respond to the extremely difficult situation in Ontario. Les conversations
We are continuing our discussions, of course. We are very concerned with the situation in Ontario and elsewhere in the country, but particularly through the conversations I've had with MPs from Ontario, with various mayors, and other conversations that are ongoing between our office and Ford's offices. We will be here to help, and we are working to figure out what aid they need. What I can also highlight is that there are discussions with other provinces as well in order to allocate a greater amount of resources to help them in this particularly urgent crisis.
Merci. Next question.
Thank you, merci. La question suivante est de Mélanie.
Mélanie Marquis, La Presse. Question. Good morning, Mr. Trudeau. We will be receiving the 300,000 first doses of Johnson & Johnson at the end of April. The fact that the vaccine has been suspended in the States, for example, does that change your supply strategy? Are you taking this into account? We will continue to expect the reception of these doses at the end of April and then the other doses thereafter. Of course, we will closely follow all public health advice. We will always base our decisions on expert opinions on the health and safety of Canadians. Perhaps I can turn to Minister Anand to give a bit more information.
Oui, merci.
Yes, thank you very much, Prime Minister. We are working diligently with our providers to bring these J&J doses here in Canada, and that is our priority right now. At the same time, we are following Health Canada information and guidance. As it stands, our government's priority is to have a greater number of doses more rapidly here in Canada. Thank you.
We are focused on receiving as many vaccines as possible, as quickly as possible in this country. We're expecting a delivery of the J&J vaccine at the end of April. Of course, before those vaccines are distributed, we will ensure that Health Canada is continuing to approve this Janssen vaccine for use safely in Canada. We will always put the health of Canadians first and foremost.
En suivi, Mélanie?
Oui, sur un autre sujet.
On another matter, some Conservatives yesterday announced their climate plan. There is a carbon pricing element in it. Now, do you expect an adversary for the next elections that takes the environment seriously? I know that the plan is vast, but could you tell me what you think more specifically about what is being called petropoints by the Liberal Party? First of all, people have been expecting for a long time, have been waiting for a long time for the Conservatives to take climate change seriously. Unfortunately, they will have to wait for a long time again, because the plan the Conservatives presented yesterday is simply not a plan. It will make it cheaper to pollute. It will increase costs for families, and it will not reduce emissions to the levels that we need. For the past 5 years, we have taken climate change very seriously. We will continue to be ambitious, but we will also continue to ensure that we help families to move forward in a world that uses less carbon emissions. We have a serious plan. What the Conservatives put forward is simply not serious. It encourages people to spend more for fossil fuels and even reward them for using fossil fuels.
Canadians have been waiting a long time to see the Conservative Party take seriously the fight against climate change, and unfortunately, with what they put forward yesterday, Canadians are going to still wait a long time to see the Conservative Party get serious about climate change. The plan, the approach, the pamphlet, not the plan, that they put forward yesterday actually makes it less expensive to pollute, makes it more expensive for Canadians, and will not fight climate change and reduce emissions nearly enough. With Erin O'Toole's carbon tax, the more you burn, the more you earn. That doesn't make sense to anyone. We're going to stay focused on a real plan that not only is ambitious and stringent against carbon emissions, but supports businesses and families by returning more money to average families across the country, and indeed creates jobs and economic opportunities as we know the world is moving in that direction.
Last question over the phone.
Thank you. Merci. La prochaine question. The next question is from Ryan Tumulty of the National Post. Please go ahead.
Yeah, hi there. Moderna's news that they are cutting their shipment and that they might miss their quarterly target. I know previously they had said that it was a quality control issue. Now they are saying that there's a bit of a supply problem. I'm wondering if your level of trust in this company's ability to deliver is shaky at all.
We have been extremely well served by Pfizer that has been delivering every week 1 million doses of vaccines, and we are seeing that double next month with millions and millions more in the month of June. So that is reliable and will consist of the bulk of the vaccinations that we're going to be giving to Canadians in the coming months. We are concerned about the delays and the production challenges around Moderna, but perhaps I can turn to Minister Anand to speak more directly on Moderna.
Okay, well, thanks, Prime Minister. I think we should go back to our diversified portfolio of vaccines, and we have seen that various suppliers have ramped up at different paces. And Pfizer, as the Prime Minister mentioned, is very reliable in terms of the supply that we are receiving. Moderna is still ramping up, and that is the reason for the reduction in the next shipment, for example. But I do want to emphasize that Moderna did meet its first quarter targets, and it is still possible that we will be on track for our second quarter deliveries. Having said that, we are going to press Moderna going forward to make sure that Canada's voice is known and heard, and that we very much expect them to meet their quarterly delivery targets. We appreciate the difficulties that the company is experiencing, but again, from our government standpoint, we are still seeking to ensure that the quarterly deliveries are there, just as we did in the first quarter of this year. Thank you.
Okay. Nous attendons.
We expect Moderna to meet its objectives and its promises when it comes to vaccine delivery in the second quarter, as was the case with the first. We recognize that they are facing production issues. We are lucky to have a diversified portfolio that is allowing us to count on Pfizer as well, which is increasing its deliveries in a significant way, but we will continue to work with Moderna in order to ensure that we receive as many doses as rapidly as possible.
Yeah, sir, I'm just wondering too, now that you have these additional Pfizer doses committed, it would seem that you might be able to move up your target of vaccinating everyone by September. I'm wondering if you think that's possible, if you think Canadians will be vaccinated earlier than that. Also wondering if you're going to try to do more about vaccine hesitancy now. Certainly we've seen a lot of that with Astrazeneca, and now that we have a more robust supply, I think that might become more of an issue.
As we pointed out today, we're well on track to reaching in the upper 40 to 50 million doses by the end of June. That means, on the math of it, many or most Canadians will have been able to receive a first dose of the vaccination. That, of course, depends very much on provincial decisions on pacing and on target populations. We know there are a number of Canadians who will get 2 doses, but many others will have gotten their 1 dose by the end of June. That is part of the strategy and the recommendations laid out by our National Advisory Council on Immunization. We're going to continue to try and accelerate doses to Canada, but the one thing we have been firm on and are able to reassure everyone on is that all Canadians who want a vaccine will be able to be vaccinated by the end of September.
Merci. On va maintenant passer aux questions dans la salle.
Oui, bonjour, Monsieur Trudeau.
Louis Blouin, Radio-Canada. I have a question, a more specific question on the Canada Medical Association's request. You said that you were open to a reallocation of vaccines based on hotspots, but could you tell me more specifically where discussions are with the provinces? Have you felt a certain openness to provinces to perhaps send doses to Quebec or Ontario? What kind of answer or response have you had from provinces? We have established a fair allocation strategy for vaccines after consulting provinces. To change this formula, we would have to receive the approval of provinces. We'd need preliminary discussions. It's a priority for a number of provinces to be able to receive more vaccines, but we know that there have been concerns with regards to COVID throughout the country. So we will continue these discussions.
David?
David Aiken, Global News. Good morning, Prime Minister. I want to talk about the Government of Ontario. So just quickly, my understanding is the Government of Ontario has not made any request for federal assistance, and that today you're responding with some initiatives, possibly at the request of mayors. So I wonder if you could confirm that. And then 2, Do you have confidence that the government of Ontario is acting in the best public health interests of its citizens?
Throughout this crisis, every order of government has been doing everything they can to protect Canadians, to help Canadians, to work together. Since the beginning of this pandemic, we've had close to 30 First Ministers meetings in which we have all shared our preoccupations, our concern, our priority, and our desire to work together to make sure that Canadians are kept safe and that we get through this as quickly as possible. There are things that we can and must and have been doing together, and there's always more that we can do together. As a federal government, we have a number of different responsibilities, including procuring and paying for vaccines, but also delivering PPE, providing surge support on contact tracers, on the Canadian Red Cross, even the Canadian Armed Forces. We are there to help, and what we have said repeatedly to all premiers is that we are there to help whatever is necessary. I made a promise to Canadians. I would have Canadians' backs, and that's exactly what I have. We have been discussing closely in an ongoing fashion with the Ontario government, with various officials. We have received a draft request from the Ontario government. We're going to continue to work with them on whatever they need, and we're going to continue to put forward ideas about how we think we can better help. This is a moment where all hands are on deck, and we're all working together to get through this difficult third wave.
Prochaine question.
Bonjour, Boris Proulx du Devoir.
Boris Proulx, Devoir. The first Johnson & Johnson doses will arrive ready for May. What should provinces expect? Will Health Canada give its support because the vaccine has been suspended in the States, or will it only be reserved for a certain part of the population, as is the case for Astrazeneca and the 55 and overs? Answer, as you know, Health Canada has already approved the use of the Janssen vaccine. We will continue to follow new information internationally on all different vaccines. We, of course, are aware of the decision made by the American authorities with regards to Johnson & Johnson. We will continue to follow Health Canada directives, but people understand that we would rather have the option of delivering these doses. We will accept this 300,000 dose shipment at the end of April. And at that point, we will follow the recommendations, the most updated Health Canada recommendations, and that of our National Commission on Immunization.
Unsafe Prime Minister Kristen Ashkatay, TV National News. Ontario, you've been asked this already, but I want to ask again. Ontario hospitals are in crisis. You have the Canadian Medical Association calling for a national strategy for healthcare workers. When will you step in and start allocating sources to the hotspot areas? You said throughout the pandemic you will offer to help the provinces. ICU numbers are filling up. More and more people are getting sick with this third wave. When will you step in with federal measures? What actions can you take now, Prime Minister?
Every single vaccine dose that arrives in Canada is distributed to the provinces and territories, with a small reserve for federal institutions like corrections, according to a formula that was agreed on by all provinces and territories. It included, for example, a carve-out early on for northern communities and remote communities. It was carefully discussed as the right way forward with the provinces and territories. And in order for us to make adjustments to that formula, we will be working, we would need to work with, as we are right now, with provinces and territories. Right now in this third wave, there are hotspots in different parts of the country, particularly in Ontario, but there are also concerns and caseloads rising right across the country. Throughout this, all premiers have had the same goal: get through COVID-19 as quickly as possible. And we are going to continue to work together with the premiers, with all Canadians, to make sure that we're doing the right things every step of the way.
Hello, Mr. Trudeau, Mal Hamidi with the Canadian Press. What the argument with your oldest son was about, and what did you say in your explanation that could apply to those feeling the same way across the country, who feel that they have done their part, but public officials haven't?
Xavier's 13 years old, and he misses his friends. He doesn't want to be doing school online. He wants to go outside and play basketball. He wants to, with his friends, he wants to have the normal life that, quite frankly, we all want right now. We want to get back to normal. We want this COVID crisis to be over. We don't want to be told that, no, we're going to have to hunker down for a few more weeks. But the reality is, we know that the best way to get through this is for each of us to follow local public health rules. No matter how frustrated we are, we also know that if we don't, we're putting at risk our summer. We need to flatten the curve in this third wave. And I know in households across the country, parents are having to talk to their kids about restrictions that parents don't particularly feel enthused about either. None of us want to be going through this third wave right now. None of us want to be having to hold back from going outside and enjoying the nice weather and being with our friends and trying to get back to normal as we've been through this incredibly difficult winter. But the fact is, we are in this third wave. It is serious, very serious in Ontario and in some parts of the country, and it could get more serious in other parts of the country. This wave is different from previous waves, in part because the variants of concern are more communicable and more serious. That means the things that we did before might not protect us the same ways. That's why listening to public health advice, following the rules, and hanging in there for a few more weeks, maybe a couple more months, is going to be the way we can get to a summer that is as close to normal as we could hope for. I know we're all frustrated, but we will get through this as long as we give it one last push.
Thank you, Prime Minister. Last question before you have to leave.
Thanks. Hi, Rafi Boudjikanian, CBC News. Prime Minister, we're hearing from Quebec just now that this weekend trucks with megaphones are going to drive around certain neighborhoods to tell people to get lined up for Astrazeneca shots, especially with the Moderna delay. What do you view as your role in convincing other public health authorities and Canadians that AstraZeneca is safe, especially for cohorts under 55? Thanks.
Obviously, we will every step of the way follow the best advice of medical professionals and health experts. Health Canada has reconfirmed that the AstraZeneca vaccine is safe for use. There are side effects, but they are so rare that it is much safer for people to get vaccinated with whatever vaccine is offered to them than to go unvaccinated, particularly in this third wave. We will continue to emphasize and put forward those recommendations. And of course, like always, we will turn to doctors to emphasize that, which I'm happy to do right now by turning to Dr. Tam.
It's Dr. New.
Dr. New, that's right.
Tam
Dr. Tam had to leave. Go ahead. Go ahead, Howard.
So what specific question and point? Sorry, I just wanted to make sure I'm answering the right part.
It was on
there.
encouraging people to get vaccinated, including with the AstraZeneca vaccine, which Health Canada has reconfirmed is safe.
I think we've repeated it many, many times, not just Dr. Tam, myself, but I think experts and public health authorities across the country. You know, all of the approved vaccines by Health Canada are very safe and effective. I think the proof is in the pudding, as they say. Millions of doses of the AstraZeneca vaccine have been administered around the world. And this rare event is exactly that. It's very rare. Look in Canada. We've had, I think, the one reported case in Quebec. And as I mentioned yesterday at my technical briefing on vaccines, we've actually administered over 700,000 doses, 709,000 doses to be exact. And I'm sure the number is increasing. So that gives you an idea of the rarity of this event, and the fact also is that we can treat this event. Physicians are now getting sort of information and education about how to quickly detect this very rare side event and how to appropriately treat it. And this individual who had the rare side event is recovering. But having said that, look at the 700, almost 710,000 doses that were administered. All those people now have a level of protection against COVID-19 that they didn't have before. So I think I'll just leave it at that. I'm not sure what more we can say. We've been keep repeating the same thing. So there you go. Thank you.
Thank you, Dr. New. Merci, Monsieur le Premier ministre.
Merci tout le monde.
On va donc retourner au téléphone.
We'll now move back to the phones for questions for Dr. New or Minister LeBlanc.
Oui, thank you, merci. And so please press star 1 if you have a question. Veuillez appuyer sur étoile 1 si vous avez une question. The first question, la première question est de Lina Dib de la presse canadienne.
Lynn Adib, Presse Canadienne. Question.
Lina, tu es peut-être sur mute.
You might be muted, Lina.
On peut peut-être passer à la...
Perhaps we'll move on to the next question. Lina, go ahead. Question. I didn't know that there was a mute option on my old phone. My question is for Dr. New. It has to do with the Montreal F1 race. Are you considering quarantine exceptions so that the Montreal Formula One race can happen, the Grand Prix? Or will they still have to quarantine? Well, thank you for the question. I believe that the first thing I can say is that I love sport. I love Formula One. I remember Jules-Jacques Villeneuve's exploits in the past and Lewis Hamilton and his exploits today. I'm a fan of sports, and like many Canadians, that is the case. But we are currently managing a pandemic. We are in a third wave here in Canada. So this is also something very important to highlight. Usually, with regards to public health, we need a good collaboration and coordination at every level. At the federal level, we are waiting to see if there is a proposal to perhaps organize an event to see what will be able to be done here in Canada. We could perhaps have support letters from public health at the federal and provincial level, because they should feel comfortable and confident with the proposal of having certain testing protocols and quarantine protocols for sporting events. I can also say that it is very important to respect local perspectives, because there are local health authorities that are in the field that knows the situation better than anyone else, the epidemiology better than everyone else. They know how their local healthcare load is, for example, here in Montreal. So at the federal level, we will see if there is a proposal put forward. We're still waiting to read and receive local support letters and provincial support letters before we federally begin analyzing the situation. And we are waiting for these support letters. As it stands, we have yet to receive one. Thank you. A follow-up, Lina? So if I understand, Dr. New, you're saying that you've received no request with regards to the Montreal Grand Prix? Is that what you're saying? Before you answer, sorry. I have another question for Minister LeBlanc with regards to the budget. Minister LeBlanc, there was a Hélène Buzetti editorial in the newspaper saying that the parliamentary budget officer states that the $70 to $100 billion over 3-year economic recovery plan would be too late. Just help over the first year. would be enough because people haven't been spending a lot since the beginning of the pandemic. Is the government taking into consideration the PBO's recommendations? Does the government intend to maintain its $70 to $100 billion economic recovery? And if you won't take into account the PBO's recommendations, then why? I will begin. So just to conclude the question with regards to the Montreal Grand Prix, we are aware of the situation. We are in constant communication with the province. The federal government has good levels of communication with the provincial governments, and it is the province that received the Formula One request, and they let us know that they were in discussions. But as I already explained, at the federal level, we are waiting for support letters before moving forward, and we're allowing public health authorities at the provincial level to make a decision, as well as the Montreal Health Authority. We will allow them to have their own discussions within the province and a municipality before we move forward. We're waiting for their support letters. As it stands, we have yet to receive a support letter from the local and provincial level. Does that answer your question? Perhaps, Lena, when it comes to the economic recovery plan, of course, we are always interested to hear what the Parliamentary Budget Officer has to say. His research, his public policy research is all very important and, of course, is part of the decision-making process undertaken by the Cabinet and the Minister for Finance. However, we have announced our intention to have an economic recovery plan that is calculated based on Canada's GDP, concurrent to what European countries have done, and also taking into account financial experts and academic recommendations with regards to our economy and seeing what other countries are doing with regards to post-COVID stimulus. The impact that we have felt from COVID is different here than it was as compared to other recessions in the past. Some sectors have been very strongly affected, for example, the tourism industry, arts and culture, scene, theatre, other performances, travel, restaurants, and hospitality as a whole, in fact. And so the Minister for Finance, and the good news is that the Minister for Finance will have a lot more to say in just 3 days, actually, this coming Monday. I believe that Canadians will be happy with the direction taken by the government to support them during this economic recovery. Thank you. One final question on the phone. Operator?
Merci, thank you. La dernière question, the last question is from Cormac McSweeney, City News. Please go ahead.
This next question is for Minister LeBlanc. Minister LeBlanc, Ontario, just moments ago, has announced that it is turning down the federal offer of Red Cross help with vaccination efforts, saying the problem here is supply of vaccines, not the capacity of the province to deliver those vaccines. If I can just get your reaction to Ontario turning down this offer, and then as well, will this rejection affect any of the other help that the feds are offering Ontario?
Obviously, the Prime Minister said a few moments ago, and we have said from the beginning of the pandemic, that the Government of Canada will always be present to do whatever we can to support provinces and territories as we all go through together these very difficult weeks and months of the past year. So obviously, if the Ontario government has specific requests that the Government of Canada can fulfill, we will move expeditiously to say yes to requests that we get from the Ontario government. With respect to the supply of vaccines, obviously we share the impatience of all Canadians to receive a vaccine as quickly as is possible. And that's why, for example, the good news that the Prime Minister shared around additional Pfizer doses coming sooner than we had expected even a few weeks ago, let alone a few months ago. All of this is part of our continuing effort to get as many vaccines into Canada as quickly as we possibly can from different sources around the world to build in those redundancies. And we'll continue to do that because, like Premier Ford and like all Canadians, we understand the urgency and the benefit of vaccinating as many people as quickly as possible. That's why it's such a huge priority for the government.
And just as a follow-up, Minister, can you clarify whether Ontario asked for vaccination help in the draft letter that it sent to the federal government? But then also on top of that, travel restrictions between provinces. What conversations are you having with premiers right now? And is the federal government going to be involved in any way at all in helping with travel restrictions between provinces? Or are you largely just going to leave that up to the individual provincial governments?
So with respect to the possible request for assistance that comes from the Government of Ontario or any other provincial or territorial government, as you know, these are formal requests under a formula that's existed for many, many years that are sent to my colleague, the Minister of Public Safety, Bill Blair. And obviously, the government's decision from the very beginning is to move as quickly as possible to say yes to all of these requests as soon as we get them. Sometimes officials share potential drafts of what a request for assistance might ultimately be in order to help Canada, the federal government, better prepare to say yes. And move as quickly as we possibly can. So there are often ongoing conversations between officials, and obviously we remain open 24 hours a day, 7 days a week to any of these requests from any provincial government. I talk to different provincial ministers and provincial premiers from time to time. And this is an ongoing collaborative conversation. With respect to travel between provinces and territories, those are properly decisions that provincial governments make. The Prime Minister, my colleagues have referred to, for example, decisions that the Atlantic premiers took to create a bubble where you could travel between the 4 Atlantic provinces. But right now, as I speak to you from Moncton, New Brunswick, I am not able to go to Nova Scotia without having quarantine obligations imposed on me, and the same thing would be true somebody coming to New Brunswick. So provinces from time to time, based on the public health advice of their public health officials, make these decisions. They're properly within provincial jurisdiction. If other provinces want to enact other measures at their borders with respect to travel between provinces, they're obviously free to do so. The Government of Canada is there, again, to support these decisions, not to substitute our decisions for the decisions of provinces. That wouldn't be the way to proceed. But obviously, if provincial officials ask for help, if it's research assistance, if it's public health information, or ultimately if they ask for specific help around enforcing certain measures, obviously, again, back to your previous question, we're more than happy to do whatever we can for as long as we can, and that's the position the Government of Canada has taken, but it really is in support of provincial decisions with respect to interprovincial travel.
All right, we're just going to go quickly before wrapping up 2 quick questions in the room.
Great. I'll keep Minister LeBlanc sort of on the same topic. The Prime Minister speaks with 3 premiers, your former caucus colleague, Bonnie Crombie, your former Commons colleague, Patrick Brown, and I'm certain Mayor Crombie would have told the Prime Minister, I don't know if you heard the call, that she's running out of ICU spaces. She doesn't have healthcare workers. So I wonder if you're talking to Premier Ford to say, no, really, Premier, you really do need our help. He doesn't seem to want to ask for it. I wonder if your current Ontario caucus colleagues are saying, please, get Ford to ask for help because Ontario needs it.
Well, obviously, my caucus colleagues from Ontario, my cabinet colleagues from Ontario, talk frequently to me and to other ministers about the circumstances in Ontario. Our COVID cabinet committee discusses as recently as 2 or 3 days ago. We're looking at having another meeting this weekend in order to ensure we have the latest information in terms of what's happening across the country, and obviously with a deep concern for what's happening in Ontario. But the way the system works, the province of Ontario has the insight as to what their particular needs are. And at any time they think that the government of Canada can be supportive or can offer assistance, we're happy to do so. We're happy to provide that assistance. It's not helpful for us to preempt provincial decisions around what is the specific needs they have. I know that there are conversations, for example, just to use another example, I spoke with the Premier of Newfoundland and Labrador today, Premier Fury, who is looking at whether there are Newfoundlanders who would volunteer, public health professionals who could volunteer to go to Ontario and perhaps support some of the specific needs that health authorities in Ontario have. So provinces amongst themselves are obviously looking at what they can do. I said to Premier Fury, for example, if he's able to have a group of volunteers that would go and fulfill a particular need that he identifies with the Ontario government, perhaps the armed forces could provide transportation for those people to go to Ontario. So these are exactly the kind of ongoing conversations that happen multiple times a day. And obviously, we'll continue to be open to do whatever we can as quickly as we can.
My follow-up is for Dr. New, a science question, Dr. New, from one of my colleagues. We've taken note, of course, that whenever we see some adverse effects with either the Astrazeneca or in other countries with the J&J, there seems to be a pretty distinct gender imbalance. It's women who seem to be experiencing some of these side effects. I wonder if you have any science on why that is, why it is women rather than men who typically are experiencing these side effects, and what conclusions we might draw from that.
Well, thank you very much for the question. What I would challenge the premise to the point that my understanding, and I'm not the regulator, certainly Health Canada has been looking very carefully at all of the data that has been provided both by the manufacturer, because they did impose new terms and conditions on AstraZeneca, as well as looking at the data that was presented in other fora, for example, the European Medicines Agency. And my understanding is to date, based on the fact that it's such a small number, if you're looking at, quote, stratification by age and gender, there's not enough, information, data, or evidence to really indicate that a specific group is at higher risk. So I think it's still an evolving situation. We'll all continue to look at the data, including, obviously, as you say, it's a very live issue right now in the United States. I understand that their, quote, NACI equivalent, which is, I think, the Advisory Committee for Immunization Practices in the U.S. is looking carefully at the information data as well to see if they could or should be making any recommendations with respect to sort of the public health rollout of the vaccines. But at this point, I think it's still a live issue, and there's no evidence that I'm aware of that really would lead us to say that it could or should be really, from a, like you say, gender perspective, be aimed at restricting its use in that sense. But having said that, science continues to evolve, evidence continues to accumulate. To be honest, as we're rolling out the vaccines, as millions of these doses of vaccines are being administered around the world, we're getting more and more information in terms of real world, what we call effectiveness of these vaccines. Thank you.
Dernière question.
Bonjour, question pour le ministre.
Question for Minister Leblanc. I would like to hear what you have to say on the idea put forward by the Canada Medical Association, saying that vaccines should be redistributed based on hotspots and resources should also be redistributed as such. Will the federal government, or does the federal government not have a responsibility at the end of the day to step in and say, well, listen, everyone, there's a very serious situation, for example, in Ontario, and we have to redirect doses to the province? Is there a certain level after which the federal government will finally decide to step in? I believe that the Prime Minister very well explained the vaccine sharing formula that is used. This formula was proposed by the federal government in December 2020. Or rather, it's the provinces that proposed this to the federal government. And so the current sharing formula is the formula put forward by the collective efforts of provincial premiers. They made the request. That being said, we were concerned to hear the circumstances in a number of regions in our country, but the fact remains that any discussion with regards to changing this vaccine sharing formula will have to begin with a consensus between premiers at the provincial level. And I know that this kind of conversation is currently underway, but I don't believe that we are on the cusp of receiving a consensus from provincial premiers throughout the country to change the sharing formula that is used, and that was accepted by all premiers and that was proposed by premiers last December. You have a tool, the Emergency Measures Act, that would allow you to reassign resources and doses. Do you believe that the door is closed to the use of the emergency measures through the Emergency Measures Act? We can undertake many measures without turning to the Emergency Measures Act. The government's cabinet isn't considering this kind of eventuality right now, and premiers have also not asked us to invoke this legal tool.
Merci. Bonne journée. Have a good weekend, Howard.
Yeah, you too, Minister.